Brain's alarm system. The brain doesn't distinguish between physical pain and social pain. Both activate the same neural circuitry. Being rejected by a group lights up the same regions as touching a hot stove. For most of human history, being cut off from your group meant death within days. The alarm was supposed to be temporary. Get back to the group. Turn off the alarm. Modern loneliness breaks that system. The alarm stays on. A nervous system running a permanent low-grade emergency signal produces measurable damage across every organ it's connected to. Which is all of them. The immune system. Loneliness triggers chronic inflammation. The body interprets social isolation as a physical threat and deploys the same immune response it would use for a wound or infection. Pro-inflammatory cytokines flood the bloodstream, running for years without a break. It's the immune system eating its own host. Chronically lonely people show elevated inflammatory markers comparable to people fighting chronic disease. They heal slower, respond worse to vaccines, and get sick more often than people with equivalent health habits and better social connections. The immune system isn't failing. It's overworking on a threat it can't resolve. The heart. Chronic loneliness increases heart disease risk by 29% and stroke risk by 32%. Those figures put social isolation in the same risk tier as smoking 15 cigarettes a day. Not the same ballpark. The same tier. Loneliness keeps cortisol elevated at a low chronic level, raising blood pressure, promoting arterial inflammation, and increasing resting heart rate over years. The damage accumulates invisibly and announces itself as a cardiac event 2 decades later. By the time the event arrives, the years of quiet damage are long past connecting to the social environment of the person experiencing it. The doctor treats the heart. Nobody asks about the loneliness. Sleep. Sleep studies show more fragmented architecture, more micro-awakenings, and less slow-wave restorative sleep in chronically isolated people, independent of depression or anxiety scores. The brain's threat detection system stays partially active during sleep when it reads the social environment as unsafe. Alone in the dark with no group meant something ate you. That ancient vigilance made sense for 30,000 years and makes no sense in a modern apartment. Running it every night for a decade degrades cognitive function, emotional regulation, and immune response on a compounding schedule that never sends a warning notice. The brain. Chronic loneliness is associated with measurably reduced hippocampal volume. It accelerates cognitive decline at roughly double the rate seen in socially connected individuals. The estimated dementia risk increase is 50% above baseline. Loneliness rewires the threat detection system toward hypervigilance. Faces start reading as more hostile. Ambiguous situations read as more dangerous. The nervous system primes for rejection before there's any evidence of it. That hypervigilance makes reconnecting genuinely harder, which deepens the isolation, which accelerates all the changes above. The loop is self-sealing. Mental health. Loneliness predicts depression. Depression predicts loneliness. The same bidirectional relationship holds for anxiety. Loneliness keeps the threat detection system on a permanent hair trigger. Reading is generalized anxiety even in the absence of any identifiable threat. The symptoms loneliness produces: social withdrawal, negative cognitive bias, reduced motivation, flattened affect, are precisely the behaviors that make reconnection harder. The condition manufactures the obstacles to its own cure. Breaking the loop almost always requires external support, which is exactly what the condition makes it hardest to reach for. The mortality gap. A 2015 meta-analysis of 148 studies, 308,849 participants, found that people with adequate social relationships had a 50% higher likelihood of survival compared to those who were socially isolated. 50%. That is a finding larger than the survival benefit of most medications currently prescribed. Loneliness as a mortality predictor outperforms obesity, physical inactivity, and chronic air pollution in most direct comparisons. The UK and Japan both appointed government ministers for loneliness in recent years. Who is actually lonely right now? Young adults in their 20s currently report the highest loneliness rates of any age group in most developed countries. Not elderly people living alone. 20-somethings with full phones and empty evenings. Heavy social media use correlates with higher loneliness, not lower. The quantity of social contact is largely irrelevant. The protective factor is felt security. The subjective sense that specific people know you, would notice your absence, and would show up if you needed them. 2 or 3 relationships with that quality outperform 50 surface connections on every health metric that matters. Why just trying harder doesn't work? Chronic loneliness physically alters the threat detection system in ways that make social situations cost more neurologically than they do for a non-lonely person. The lonely brain reads neutral social signals as threatening. The very faculty you need to reconnect. A nervous system that doesn't treat other people as a threat is the one that's been degraded. The interventions with the best evidence base don't start with new social behavior. They start with addressing the cognitive distortions loneliness produces first. Change the interpretive filter. Then the behavior can follow. Conclusion: loneliness doesn't show up on a blood test. It doesn't have a medication. It produces its damage across a dozen systems simultaneously on a timeline too long to connect to any single clinical event. Doctors ask about smoking, diet, exercise, sleep. Almost none ask about the quality of a patient's closest relationships. The 50% survival gap is larger than the benefit of treating high blood pressure. Larger than statin therapy. Larger than most of what doctors actually spend their time managing. The intervention doesn't require a prescription. It requires 1 or 2 people who actually know you. The simplest medicine on this list is also the one the system is worst equipped to deliver. Because nobody has figured out how to bottle it, patent it, or bill insurance for it. That gap between what the data shows and what the system treats is where most of the damage quietly accumulates. One isolated person at a time.